Well, hi everybody, this is Jenny. I just had a laparoscopic gastric bypass performed on October 30th, 2008. Um, I was a pre-op, and before I got this procedure done, there was a couple of steps that I had to take before I had the surgery done. I had to go to a psychiatrist to get a clearance from the doctor to make sure that I knew what I was getting myself into. Um, I had to get a clearance from my physician, my head doctor. They do a series of testing of blood work. You go to the hospital and they do an EKG in your heart, lungs. Um, then you see the surgeon. This not. I'm sorry. You'll see the anesthesiologist, who will explain to you that um, they're gonna have a tube in your throat, down your throat, when you wake up from recovery. That you're gonna have a team of nurses around you, watching your process as you wake up. And I can tell you that that's exactly what happened. I went into the hospital at 6 o'clock in the morning. At 7 in the morning, they prepared me with an IV, and I went into. Actually, there was a patient before me, but was a diabetic, and he was a little more complicated. So they put him, after me. So I was first, and I was taken into the surgery at 7:30 in the morning, where I don't remember anything but waking up in the recovery room, and I remember having the tube down my throat, and I knew that if I would mentally stay calm, I was giving myself therapy, like you have to stay calm, and I knew that the longer I stood calm, the faster they would remove the tube from my throat. I saw the nurse bringing down the knob to where she shut down the machine that was helping me breathe, and she automatically took the tube out of my throat, and the first thing that came out my mouth was, "What a relief." I was smiling, I was awake. One of the nurses said that they had not had a patient like me in a long time to take recovery so well. I remember that when I was really in a clear mind, I started feeling pain. Well, then they gave me a shot for my pain, and then I was taken up to my room, uh, where I was sleeping for a couple of hours, but I managed to wake up again, and I managed to actually walk after the procedure. And I walked up and down the hallways like maybe 4 times on my first day. It was very painful, but I was much better the next day. It was painful because I was gassed up, and as you walk, you relieve the gases in your stomach, and you're gonna feel much better the second day, the third day. Um, I was in the hospital for only 2 days, and the first week I lost 15 pounds. The second week I lost 20 pounds. In the past 8 weeks now, I have lost 35 plus pounds. I believe I haven't weighed myself since the last time, and the last time I had lost 35 pounds, so that was like maybe a week and a half ago. So I don't know, if I have lost any, more weight now, but I know that my clothes is big, big on me even with 35 pounds. I have jeans that didn't fit me before that fit me now, and that's really encouraging, you know. And I did look up all my credentials for my doctor. I was I had the best team of doctors, uh, Jorge Sosa and Dr. Eric Valladares, great team doctors. They're in the excellent field of bariatric excellence center, and I am very glad that I had them for surgeons. Um, Everything is a process. Um, it's only been 8 weeks. I'm still healing inside. As you all know, that this is not a miracle surgery. There has been people that have regained the weight back, but you have to start by exercising, walking, bicycle riding, anything that will help you burn the calories. So we don't stay flabby. Um, Increase your metabolism and go to your dietitian. Don't miss your appointments. That's very important. Learning how to properly eat. I've noticed that in the 8 weeks I've had to learn how to eat slow. And sometimes it's difficult when you have someone that eats fast next to you, and so it's better to just sit by yourself and try to eat by yourself until you learn how to eat slowly. Because if you eat fast, you will throw up your food. Um, my surgery was a success, and the most important thing that I can say today in this video is that I had a clear mind of where and what I was going to be going through. I looked up my research on laparoscopic. I researched everything, patients that had successes, patients that didn't have so much success, and the odds and the pro. I know that I had a girlfriend of mine who wanted to have gastric bypass, but she got scared and she didn't want to do it. And I tell you that if you're not mentally prepared, which is the most important and utmost thing, is to be mentally prepared. You have to mentally prepare yourself and exhaust every method of weight loss. Okay, diets, exercises. If you have exhausted all of those things and your last resort is surgery, then by all means, search your website, look up your doctor's credentials, find good doctors in the field of bariatric excellence, and hopefully you will expand the quality of your life and health. I know I have, thanks to my surgeons. Um, so I don't want you to feel discouraged. Um, I want to say that all those that wish me the best, I had a lot of support from my friends and my family, and I can tell you that I give all those out there that want to have the surgery my support. But please, by all means, do your search. Search everything before you decide to make any decisions. I will keep you posted on my next video on how much weight I've lost. So I hope everybody finds themselves in good health and spirit, and see you soon. Bye bye.